Good day, dear friends. Glad to welcome you on Dr. Savkin's channel. Very often, when there is pain in the joints, doctors prescribe non-steroidal anti-inflammatory drugs. At the same time, many of you are usually interested in the question, which drug from the group of non-steroidal anti-inflammatory should be preferred? Can an overly expensive drug be replaced with a cheaper one without harm to health? And how to avoid complications when taking this or that drug. We will talk about this with you today, as practice shows among the mass of non-steroidal anti-inflammatory drugs, Diclofenac, Nimulid, and Movalis are most often prescribed. All of them are used for the treatment of muscle tendon apparatus and joint diseases. At the same time, the choice of one or another drug depends primarily on the presence of a specific disease and the background of accompanying pathology. For example, it is best to take Mavalis for osteoarthritis, not Diclofenac. Since Mavalis, the active ingredient of which is meloxicam, unlike Diclofenac, has a positive effect on the metabolism of cartilage tissue. And if a patient suffers from any liver disease, say hepatitis or fatty liver disease, as well as gallstone disease, Nimulid should not be used. In other words, Nimulid, as this group of drugs, can have a negative effect on the liver. Mavalis is devoid of toxic effects on the liver. In that case, if there is a need for quick relief of the pain syndrome, it is worth turning to the drug group of Nimulid, for example, Naizu. It has the ability to quickly alleviate pain in the shortest possible time. But Mavalis takes much longer to relieve pain. However, the effect when taking it is much longer than when taking Nimulid. I most often recommend my patients to take Mavalis, the active ingredient of which is meloxicam. Why? First and foremost, because I find it to be the most effective and safe. It selectively inhibits cyclooxygenase 2, therefore it much less frequently than other non-steroidal anti-inflammatory drugs causes various types of bleeding, and primarily gastrointestinal, which is especially important for elderly people, as well as in the presence of peptic ulcer disease of the stomach and duodenum. Rashes are less commonly observed. It's no secret that many non-steroidal anti-inflammatory drugs contribute to water retention in the body, resulting in edema. With the intake of Mavalis, we significantly less often encounter the possibility of developing acute renal insufficiency. Many of those who have repeatedly turned to Mavalis for help throughout their lives regret that the effect of its intake only begins on the third or fourth day. This is really so. This drug does have a fairly long half-life. However, as of today, we have an intramuscular form of Mavalis. And in this case, the relief of the expressed pain syndrome occurs much faster. As practice shows, in the treatment of osteoarthritis and osteochondrosis, it is worth resorting to the step-by-step method of Mavalis therapy. Specifically, during the first 3 days to relieve acute pain syndrome, an intramuscular form of the drug is prescribed. Then they switch to its tablet intake. Not so long ago, Movalis was a quite accessible drug for each of us. However, recently its price has significantly increased. From this perspective, it's worth noting that there are cheaper drugs available. First and foremost, I'm referring to meloxicam, which is not inferior to Mavalis in terms of effectiveness or safety. Some of you who are watching me now are probably wondering why I'm not paying special attention to Celecoxib, which is even more selective than Mavalis meloxicam. If meloxicam is less safe in terms of the stomach and intestines, then Celecoxib, known to many under the trade name Celebrex, is more dangerous for patients with cardiovascular diseases. In addition, as practice shows, Celecoxib most often causes headaches, dizziness, and flu-like symptoms. Moreover, Celecoxib does not have as many generics as meloxicam, so these drugs are much more expensive. Stay healthy, dear friends, and until new meetings,